so now we didn't have exactly the right size containers. For a face bath, which is what I'll demonstrate first, you want a basin maybe a little bit smaller than this, like a kitchen bowl. Plastic ones work fine, just kind of a round one. And you want to be able to get your face in, but not be so big that it takes there's a lot of extra water. So you need a little depth and not quite so big around. This one is more like a foot tub, but that's okay. Well, you can visualize, you can figure out kind of at home what you would need. Okay, and so what you do is we're going to say the hot water is in this one and the cold water is in this one. Now, I would have maybe 2 pitchers. I would have some extra hot water here, very hot water, and I would have another one for maybe some ice. And so when you get this set up, then you want to have a little extras on hand, because as you do this treatment, the water is going to cool a little bit, the hot will cool, and the cold will heat up a little bit. So you want to keep adding to that. And so what I would do first is get everything ready, and you've got a couple of towels on hand so that you can dry your face. Now, if you have a timer and you want to use that, you can, or you can just count in your head, which is what I usually do. But the face bath is a very powerful treatment if you have a head cold with a lot of congestion, or sinusitis, where maybe from allergies and you've got congestion in your sinuses. This is amazing. Now, we used to do a lot of overseas work. We'd go to the Philippines, and it generally knocks your immune system down when you cross that many time zones, because they're on the other side of the world. So usually when I got there, I would get a light cold, and then that light cold would turn into a sinus infection, because there's a lot of bacteria in there, and I would get that in. And so then I would end up with this terrible drainage. So on one trip, we were teaching at a training school, and I was teaching about 4 hours a day. I was very busy preparing materials. I got this sinus infection, and I thought, I'm just going to get well anyway. I'm not going to take time to do the hydrotherapy. You know, in some places it's a little harder. It's a little harder to heat water, to get equipment and all that. So I didn't do anything. And it got worse, and it got worse, and it got worse, and it went on for 2 weeks. And finally, I was so miserable, I said, okay, I'm going to figure out, get everything together and heat the water. One treatment knocked it out. One treatment. And I was really sorry I had waited 2 weeks to do that. But that's how powerful it is. Okay, so I'm just going to kind of demonstrate for you how to do this. You want to go in the hot water first, and you have to hold your breath. Unless you can hold your breath for 3 minutes, you have to come up and go back down, okay? You have something like a little snorkel like kids play with. You could use a snorkel, so you don't have to come up, but generally I just come up and down. And so you gasp for air, go right back under, and generally count for about 3 minutes, 1001, 1002. That's the way I do it. And then you switch to cold for about 30 seconds. And then you would do these switches back and forth at least 3 times, but 6 would be even better. You can go up to 7 even. So I'm just going to show you. You want to get your face all the way in, so you go big gasp for air. And then you can start blowing bubbles out if you want, and then you come up, gasp for air again, go right back under, and then when you stick your face in the ice water, hold it for 30 seconds, if you can hold your breath for 30 seconds. And it's quite a shock going from the hot to the cold. If you have this really hot and this really cold, you may get some tingling feelings even, especially in the feet, but you can get that in the face too. And so what I would do is what I usually do to start with, to test this hot water, you want it hot, but you don't want to burn your face. You know, that's a sensitive area. So a lot of times I'll first feel with your hand and make sure that feels okay. But I kind of stick the tip of my chin in, okay? And just get that in, and then you just kind of gradually go in. And you can take it hotter as you get used to it. The face can actually take a lot more heat than you would think it can. It can take a lot. And so then you just go back and forth. And it's amazing now. You need to have, once you dry your face, you're going to need to blow your nose. If you have congestion, you're going to need to blow. So have something there where you can, a big handkerchief or Kleenex, whatever, because you're going to blow out a lot of junk out of there. It's amazing what will come out. But it's just really gets that circulation going in the face. And you could do this for an ear infection too. Just don't get your ears under. You don't want them to get cold in there. But from the face also, you're going to get the reaction with the ears to help kill out an ear infection. Now, if you have an eye infection, you probably wouldn't want to do this because if it's just in one eye, it could spread to the other eye. You want to be careful about that. So, anybody have any questions about the face bath? Okay. And so it's a pretty easy treatment to do. Now, you can also do this for your feet. And let's say you had a sprain. You sprained your ankle, and you've put cold on to start with for a few hours. Maybe the next day, wait about 24 hours, you could start a hot and cold treatment to your feet. And maybe I should just pull this chair around and I can just, I can just show you from the chair. Let's see. I'm just going to pull this around. Okay. I think I can hold it on this treatment. Now, you don't have to get undressed for this treatment. You just want to make sure your clothes maybe come above the knees so it's not going to get them wet. I'm not going to take my socks off since we're not really using water, but you can visualize, okay? And you could do this for 1 foot, but since you're doing it, why not put both in? It's great for your feet. And so I'm just going to, again, just demonstrate here. Feet in hot water for 3 minutes, okay? And let's say it's been 3 minutes. You could use a timer. You can look at a clock. How long in the cold? 30 seconds. Okay, then I'm going to change to the cold. And, of course, you've got your pitcher again with hot and cold water. And you want to keep adding hot to that. You know, you can swish it around with your foot a little bit, add a little bit at a time. Cold, go back to the hot, and so forth. And so you can do this again 3 to 6 times. Amazing, the circulation. You're going to feel some tingling if you have that nice and hot and nice and cold. Now, if you're diabetic, you can do this treatment, or if you have poor circulation, but you have to have a thermometer probably. It'd be best. You don't want to go above 102 degrees in the hot. Now, with a person who has diabetes, let me tell you what the problem can be. First of all, with diabetes, you get damage to the nervous system. And so often, people with diabetes can lose feeling, and they can't tell how hot something is. And so you can burn them very easily if you don't measure the temperature. You can't go by how they feel. The other thing is that often the blood vessels are damaged in the feet, legs and feet of someone who's diabetic. And so the tissues, when they heat up, require more oxygen. So you put the feet in hot water, it's very hot, the tissues heat up, they need more oxygen, but the blood vessels can't open up enough to carry that oxygen that they need, and you can get tissue death. You can even cause someone to have an amputation if you're not careful. So hydrotherapy is very beneficial, it's very simple, it's very easy, but you need to be careful how you do the treatments and heed the precautions. And so the maximum temperature for someone who's has diabetes, I would say a maximum of 100 to 102, no, not above 102. I wouldn't put quite so much ice in the water either, maybe cool water, warm water and cool water, because cold also requires more circulation. And so you want to be careful, but that is still a good treatment that you can do. It's a good exercise. You just have to be very careful. If you're unsure how to do it, it's better to not do it if there's a question in your mind, okay? Okay. And so you could use this treatment. Let's say you stepped on a piece of glass and you got an infection in your foot. You could use this treatment for the infection. You could use it for a sprained ankle, for many, many different problems. You could use it for swelling in the feet, for edema, for whatever. It can be used as a simple treatment, okay? Are there any questions regarding the foot bath? Yes. You would want to be careful. If you have poor circulation, you would want to use the same precautions that you do for diabetes. Okay, now we've worked in other countries. Sometimes people don't know if they have poor circulation. Often they don't even know if they're diabetic. But one thing that you can look at, which is a pretty severe sign of poor circulation, is discoloration in the skin of the lower legs and ankles. I've seen people in other countries where it's just a blue, black, purple color, and maybe open wounds around there that are crusty. I would be very careful in working with someone that indicates very poor circulation in their feet. Now, if there are other things that you can do with the hands, it's usually not a problem in someone who's diabetic. Or if you know what a fomentation, just a hot, wet towel, you can put that across the thighs of someone who has diabetes and then change that with cold. And that will get a reflex action in the feet, but without the danger of actually putting the feet in the cold. Hydrotherapy is so amazing. You know, if you break one arm and you have it in a cast, you can do a hot and cold treatment to the other arm, and you'll get a reflex action in the broken one without even putting it in water. It's truly amazing. Okay, you could also do a sitz bath for people. Now this requires a little more effort to do this, but we've worked out a way at Butler Creek without equipment that you can do this. You know those big tubs that have rope handles? They're just like maybe between $5 and $10. You can get 2 of those, and let's say you had any kind of issue in the pelvic area. That could be female or male problems. You can do a sitz bath with hot and cold. And so you put hot in one bucket and cold in the other, and you can put a little stool in there that they can sit on. You may require a little help getting up and down. First we were using a sheet with a sling, and that works, but it's a lot more effort. I think a little stool works best. And you can do a sitz bath, and it's very easy. Now, I'm just going to, and then of course, when you take your feet out, you've gone through your changes, you just dry your feet off like you would with a face bath. But I want to tell you about a treatment for children also. We use this same treatment. We used to do this at Wildwood when I worked there. And when children have congestion or a cold, one of the best things that you can do for a treatment for them is to get 2 buckets and do a hot and cold, and you put them in up to their neck. Now, those same buckets like you would use for a sitz bath with those big ones with the rope handles work very well for that. But if you have something smaller, you know, if it's a small child, but it's just amazing. Now, children don't like hydrotherapy, so it's good if you know somebody that has small children. It's good for them to start them out when they're very young, because as they get a little bit older, they just start screaming and you have to occupy them. But it is amazing, and I'll just give you a couple of little stories here. One is we were in the Philippines, and friends of ours had a daughter who was 2 years old. When we got there for that trip, she was sick, but she was getting better with some kind of congestion, cold, and so they thought she was better. And so they went shopping at the market in an open vehicle, and the cool air, it was the rainy season, the air was cool, hit her, and she got sicker. So we were out late, we were at the dock meeting some friends, and we got back home about 12 o'clock at night. It was about midnight. And they were still up with her. Her fever had gone way up, and in our terms, it was between 104 and 105, which was pretty worrisome to me. So we started praying. I said, Lord, what can we do? I can't go to bed with this child is sick. And so the parents were getting nervous. They didn't realize how high that was, but as I was talking to them, they got a little bit nervous. So I said, we tried another little treatment first, but it just, I couldn't settle her down enough to do it. So we said, okay, we'll do the contrast bath. And so we didn't have any ice, and there was no refrigerator there. And so they went to the neighbors to try to get ice, but the neighbor was already in bed. And so we had no ice. So we had tap water, it was cool. And then the father went to heat some water for the hot. Well, we had a little device you drop in the water that heats it. And it can bring it to the boiling point. But the father was very nervous, and he took that out and brought it before it was really hot. So we had warm water and cool water. Okay, and a very sick child. And then we put her in the hot bucket. She was screaming, and I realized that she was way too tall for the biggest bucket that we had, okay? So she's up to her waist in this warm water, but that was all. And I said, okay, what to do? Okay, we can pour the water over her. So I ran to the kitchen to try to find something to pour over. Meanwhile, we're praying. I was praying in my heart the whole time. Lord, show me what to do. And so they had every container was full of something except a little cup. It was a little teacup type thing that was plastic. So I brought that back, and I just started pouring that water over her with her screaming wildly. Her mother was trying to restrain her. I think we kept her in that warm water for about 2 minutes, and I said, okay, change her to the cold. She's just going wild here. So we put her in the cold. She was very mad, and we did the same thing with the cold. We went back to the warm water, and just a short warm again, poured that over, put her back in the cold. And by that time, she was so angry, I was afraid that it was going to be more harmful than it was good for her. So I said, just take her out. So her mother took her out. She took her, put her in bed, dried her off, put her in bed. The child immediately went to sleep. 5 minutes later, she took her temperature, and it was normal. That was a miracle of the Lord. And I've seen those kind of miracles in the mission field. When you have a great need and you call upon the Lord, just use these simple remedies that you have. The Lord blesses in a mighty way. Okay, all right. I'm going to end here. And thank you. I'm going to ask Lou to go ahead and come up and set up and help me move these things. Thank you.
Let me start my thing. Our subject is diabetes. Diabetes. I'll pray, we'll start. Our Father in heaven, have mercy on us tonight, and we're going to the great physician to try to find some simple answers to the difficult question of diabetes. Please help me ask it in Jesus' name. Amen. So this is going to be, so I don't have to keep looking backwards. So our subject is, really it's not diabetes. It's the principle of cause. Proverbs 26:2, curse doesn't come without a cause. The principle of cause and effect illustrated through a study in by diabetes. Okay, very simple. But you have to help me tonight. And if you happen to be watching this on this live stream, you can answer the question at home, okay? You participate with us. Be part of our congregation. So last night we covered a little bit about metabolic syndrome. These numbers that indicate risk factors. If you have hypertension, you're at risk for heart disease. If you're obese, high BMI, you're at risk for diabetes and heart disease. These risk factor numbers. The one tonight we're going to look at is blood glucose, blood sugar, diabetes. So 1/3 of the folks in America have metabolic syndrome. That means out of these risk factors, if you have 3 out of the 5 numbers are high, you're very, very at risk for heart disease, diabetes, and a number of health lifestyle issues. Pretty simple. So high triglycerides, elevated blood pressure, these numbers associated with high risk factors, and it's called metabolic syndrome. So our study, cause and effect. Now, you help me. Number 2 cause of death is cancer. All right, number 1 cause of death, heart and blood vessel disease. Number 2 is cancer. The number 2 cancer killer is colorectal cancer. What's the number one cancer killer? No, not breast. Lung. Okay, now wait. Lung. Remember, cause and effect. What's the number one cause of lung cancer? Is an effect. It's not a cause. Lung cancer is an effect. What's the number one cause of lung cancer? All right, now, cause and effect. The effect, lung cancer. The cause, smoking. What's the answer? Stop smoking. That's it. Now you're a cause and effect scientist. You just stopped smoking. Now, let's try another one. Okay? You're a cause and effect scientist now. By the way, you go through the checkout line, lose 40 pounds in 40 days, and you eat asparagus enzymes and drop 40 pounds in 6 days. That's what we call a quick fix, and it never works. The slow fix is the sure fix, but it takes some time. Would you agree? Yes. So now that's a picture of me a long time ago. Yeah, that's called a hangover. Now the problem is when a man drinks half the night, he wakes up with a hangover. Now the hangover is the effect, right? So I go down to the herb shop and pick up some hangover cure. But you know, when I met Darlene, my wife, she was a New Age Indian mystic and a spiritualist. And she was into a lot of transcendental meditation and a lot of out-of-body experiences. And so we go down to Megan's house. Can you see the ingredients on the list? Blueberries and applesauce and apple juice and mint and vanilla and oatmeal. What's the last one? Now, wait a minute. The effect is the hangover. What's the cause? What's the answer? Thank you. Isn't it that simple? I mean, it's that simple. Is that simple? Yes. Come on, somebody say yes. Yes. Now let's take that mindset into diabetes, okay? Problem, the cause, the answer. Diabetes. Now, there are 2 or 3 or 4 tests, popular tests. Probably the one used most often to determine, the doctor to get some kind of inside look in at your blood glucose, is they poke your finger, stick it on a strip, plug it into a glucometer. A1C gives you an idea of your blood chemistry for the last 90 days, but that's a more expensive test. So they use this one. They take the strip, plug it into a glucometer, and when a number pops up, if it's over 125, they say you're full-blown diabetic. If it's under 100, well, you're normal. But if it's in between, you're pre-diabetic, which is not good news. It just means you're probably headed toward diabetes. You just haven't gotten there yet. Under 100? Okay. Again, this is not the most accurate test, but it's very cheap, easy, and fast. Under 100, you're okay. 100 to 125, pre-diabetes. Over 125, diabetic. This is fasting in the morning before you have your breakfast. And it's very simple. Now, I took this off the NHS website, very scientific. This is a typical perspective on diabetes. I blew it up so you could read it. There is no, can you read that? Cure for diabetes. So treatment aims to keep your blood glucose levels as normal as possible and to control your symptoms. Now, what do they use to treat diabetes to control your symptoms? Some kind of medication. When the doctor gives you the medication for diabetes, how long do you take it? Until the day you die. That's it, right? There's no coming off. It's a death sentence. Now, Isaiah 1:17. Learn to do good. 1:18. Let's reason together. Cause and effect. We apply it to diabetes. Diabetes is the effect. There must be a cause. And if you don't know the cause, you've got no answer. So the doctor says, I'd like you to take, and in most cases, metformin, because it has the least side effects, the oral medication. You got diabetes, you're determined to have that. Now, we'll get into the type 1, type 2, and gestational in 1 minute. You go to the doctor, he gives you a medication, probably metformin, and you take it until the day you die. To do what? Control the symptoms. And the symptom, you got high blood sugar levels. Can metformin bring down the numbers? Yes. Yes, it can. Yes, it can. So now, insulin. I'm not going to read it. I'm just going to say it very briefly as I flip through some of these slides. Insulin is made by the pancreas. It is a hormone. Its chief function is to unlock the cell. The receptor site, the insulin is the key. It fits into the cell precisely, unlocks the cell like a door. The muscle cell, the door opens, the glucose goes in, insulin did its job. That's what insulin is. It's a hormone that facilitates the blood glucose moving out of the bloodstream and into the cell. If it stays in the bloodstream and the levels go up, they call it a metabolic mess. It can kill you. That's diabetes. Now, there are 3 types of diabetes. We start with type 1. In type 1, to make it, let's stay very simple. In type 1 diabetes, your pancreas is either not functioning at all or does not produce enough insulin. The problem is your pancreas. They say it's an autoimmune disease. They have no answer for it, and neither do I. Type 1 diabetes cannot be reversed. You can, through good lifestyle, help control the roller coaster of blood sugar going up and down, not being tired. There's some things you can do to help, but there's no reversing of type 1, though you can try to get some help through lifestyle. Okay, that's type 1. The good news is most people have what kind? Type 2. So the other kind is gestational diabetes, which is a woman is pregnant, doctor says, you're diabetic, and he takes some kind of step to help her, and then when she's not pregnant, she's no longer diabetic. You say, well, that's fine. That's just a temporary condition. Well, autism. Basically, autism is a disorder in the mind. If you're having lunch with somebody that's autistic, after a few minutes, you know something ain't right in their mind, right? Their social interaction, their skills to try to process information, their brain doesn't quite work right. And this is all that says. It just says their ability to interact in social situations, it's compromised. You know anybody with autism? Yeah, yes. Now, let me give you the numbers. Back in, it's hard to read, let me blow it up. In 1970, 1 in 10,000 people were autistic. And then as the years have gone by, 2004 and 6 and 8 and 10, is autism, is it becoming a pandemic? Is it on the rise? What's one of the main causes for autism? Easy, gestational diabetes. If you want to raise your risk factors for having an autistic child, be diabetic when you're pregnant. That's one problem with gestational diabetes. Another one is this. I'm going to say what's on that paragraph out of diabetes from the American Diabetes Association, but the mother has the baby in the womb. The blood supply of the mother is the same as the baby. When the mother's glucose levels go up, the baby's blood sugar goes up. The baby has a pancreas that makes insulin. It goes to the cell, unlocks a door, and the glucose goes into the cells in the baby. But the baby's sitting there like this. And so what happens to the baby when it's born? That's it. Overweight babies, which sets the stage for a number of health complications for the next 20 years. Babies are born overweight because of what? Gestational diabetes. And I'll just read for starting here. This triggers the baby's pancreas to produce more insulin to signal cells to take in more glucose. Since the baby is receiving more energy than it needs to develop, the excess goes towards fat storage. This can lead to babies that are larger than average. That's gestational diabetes. Now, there's 1 or 2 other things I want to read, but it'll be at the end. There are a lot of problems with being diabetic when you're pregnant. And if you are diabetic when you're pregnant, at some point in your life, you probably will have full-blown diabetes. So you want to address this, you got to have the cause and the effect and then the answer. So 2035, they are projecting diabetes is on the rise or on the decline. Oh yeah, it's on the rise. In fact, I think in the United States now, it's 29 million people diagnosed and certified with type 2 diabetes and many, many more people not diagnosed. So that means typically in a church this size, you'd have 7, 8, 9 people with diabetes type 2. Weighing in at just over 1 kilogram, well, this is the liver. The liver, 2.2 pounds. What does the liver do? It's got about 600 functions. It does a lot of things. Yeah, the liver does a lot of things. And by the way, if your gallbladder wasn't working quite right, you can get out the door. If your pancreas is on the fritz, you can get out the door. Liver doesn't work, you're dead before you get out the door. The liver is an essential organ. I'll get a liver transplant. You don't know what you're asking for. The liver is an essential organ that you cannot do without. Let's take 3 functions of the liver. Number 1, it produces an important digestive liquid called bile. See the green thing up under this is the gallbladder. What's stored in the gallbladder? Bile. And the bile helps to emulsify fats in the small intestine. That's one thing the liver does. It makes bile, produces bile, stores it in the gallbladder. It helps with digestion. Isn't that nice? Number 2, it cleans your blood. So a man that is an alcoholic, the way it destroys the liver, as it filters the alcohol, that's it. All cirrhosis of the liver is, I got a cirrhotic liver, you're saying you have a scarred liver. Scar tissue does not work like healthy tissue. So once you scar enough tissue, you've got a real problem because the liver can't function. And without a functioning liver, you die. Darlene's father died of cirrhosis of the liver. He was a nonstop drinker. My father died of lung cancer. He was a nonstop smoker. My father was also a drinker. Her father was also a smoker. But the cirrhosis of the liver got him first. My father was killed by lung cancer. But cause and effect. So what causes cirrhosis of the liver? That's the effect, drinking. What's the answer? You stop drinking. Now I realize these are easy things to say and hard to do, but the principle tonight is what we're studying. We're using diabetes to study the principle. So long-term liver damage, scar tissue replaces healthy tissue in the liver and prevents the liver from working properly. Now, the third function of the liver that we take, it produces, stores, and releases glucose. Now, next question is, when the doctor hands you metformin, and you take that metformin, and it brings down your numbers, what is the dynamic? How is metformin working? I went to the metformin website, and they tell you very plainly and very clearly what that drug does to bring down your numbers. And that's off of metformin's website. It decreases hyperglycemia primarily by, it goes to the liver. Dear friends, there's nothing wrong with your liver. It goes to the liver, does things with a healthy liver, and ultimately destroys it, and that's not the problem. It does not address the cause, right? The effect is diabetes. The cause is not the liver. And this is why when you take metformin, you take it until the day you die. So the question is, what is the cause? That's where we're going. Lady comes to our program. She says, doctor said I'm on metformin. It's a death sentence. I'm on metformin. She says, do I have any options? And we say, yes. Yes. In fact, look on our website. Right now on our website, Alfred Bateshu, a man from New York City, came to our program. We filmed him, put it on our website, on our lifestyle page. You can click it tonight, Butler Creek Health Center. He said, well, I came here diabetic, and I had hypertension, I had, and made some changes. And he said, I went home, no medications, and well. But he followed the plan. He was a cause and effect scientist. So what are my options? Now, before we look at that, I start top left. The leading cause of kidney failure, renal failure in the United States today is diabetes. Next, if you have diabetes, it's almost certain at some point, if you live long enough, you'll die of some kind of coronary event. On the bottom right, a traumatic amputation is when you have a motorcycle accident and they cut your leg off in the accident. That's a traumatic amputation. But a non-accident related amputation, non-traumatic amputation, leading cause is what? Diabetes. And the other one down in the other corner, people working age, that's under 65. People going blind in the workplace, the leading cause of blindness is diabetes. And the list gets longer and longer. And by the way, everything we're reading, all the statistics we're giving, that's a woman that's taking metformin. These are not people that are not on medication. They're all on medication. And the medication does not stop the ramifications of the disease because it does not address the... Have you known people that had amputations because of diabetes? We had a guest at our place. They cut off a toe. And then later they cut the other toe off. Had another friend that had part of his foot a problem. Then he had a heart attack and died. A good friend of mine in the church. And so, now, my purpose tonight is not to talk about the financial side. That's not my purpose. But let me say this about a $52 billion industry. The more drugs you sell, the more money you make. If you sell no drugs, you make no money. Now, this is not a commercial organization. This is the World Health Organization. Now, on the right, they give you some of these problems associated with diabetes. Now, do me a favor, don't read the green yet. Don't read the green. Type 2 diabetes, again, the WHO, nonprofit, the WHO. Type 2 diabetes comprises 90% of the people with diabetes around the world. What are common consequences? It is said neuropathy and kidney disease and heart disease and all. It gives you all the risk factors. Now, that thing down here, that's a picture of what? In the literature of health, an apple is a symbol for what? Symbol for diet, nutrition and diet. Now, the thing in the middle, that's a symbol for what? Exercise. Now, the thing beside it, the blue, is a symbol of what? That's it, body weight. Now we read the green. A healthy diet that helps control blood sugar, achieve and maintain healthy body weight, and then it says, can you read that fine print? A little exercise. Diet? I know I can't see it from up here hardly, but this is what it says. Trust me. I'm not Ronald McDonald. Trust me. That's what it says. Get your exercise, 30 minutes a day, 40 is better. Get your exercise, get your diet, and the other thing, yeah. Well, if you're on the diet and exercise, that'll take care of the weight. And you say, now, hold your thoughts for a few moments. This man probably, Neal Barnard, is probably the world-renowned, recognized expert on diabetes. I have his book. It's about this thick. And you can get it on Amazon, and it'll cost you a mountain of money. I have it. You can take his book, the foremost expert on planet Earth, and it's a good book. You take out the case studies, you take out the research he gives for his conclusions, you take out everything except his plan to reverse diabetes, and guess what it says? Diet, exercise, and weight. Now, type 2 diabetes, which is what most folks have. This is a picture of the pancreas. In the pancreas, you got exocrine cells, you got beta cells. The beta cells make the insulin. All sorts of cells in the pancreas. It's a very, very real work of art. God really did something when he made the pancreas, right? The beta cells produce this substance, this insulin, this hormone called insulin. Now, they call type 2 diabetes, another name for it is what? Insulin-resistant diabetes. That's the name they give it. Why do they call it insulin-resistant diabetes? Because the muscle cells resist the insulin. So the muscle cell goes to, now we're going to solve the problem of cause and effect. The pancreas, the beta cell, makes, by the way, I'm about to hit this book. It's not a Bible, it's a song book. So when you see me hitting that book, it's not a Bible. I wouldn't strike a Bible, okay? That song book, I need it for, if I need an illustration here, the song book. So the pancreas, sensing mechanisms, it sees the glucose levels going up in the bloodstream. The pancreas says, I got to make what? Insulin. So the beta cells start to remember type 2, the pancreas is okay. The problem's not the pancreas. Type 1 it is. Type 2 it's not. Type 2, the pancreas is doing okay. It makes the insulin. The insulin, released by the beta cell, travels to, we'll say, muscle cells in the body. It goes to a muscle cell. And when it gets to the muscle cell, and the muscle cell says, who is it? And the insulin says, it's insulin. And then the pancreas opens the door with a shotgun and is going to run you off. I don't want to see you again, and chases you away. That's insulin resistance. What did I say? Pancreas cell? I think muscle cell. Thank you, honey. You help me out there, you Bereans, Acts 17 Bereans. Study to show thyself approved, 2 Timothy 2:15. You got to be sharp tonight, right? You don't want anybody to put anything past you. By the way, this is going to be Simple. Let's keep it simple. Now, this time, I'll be the insulin. I'm going to the muscle cell. It says, who is it? I say, insulin. And I got my key in the door. And the muscle cell is not so friendly. It's resisting my efforts to open the door and let my friend glucose in. And I say the $10,000 question, why? And the muscle cell, very simple. Remember the WHO, Neal Barnard, the book Ministry of Healing? The muscle cell says this. Number one, you have overfed me. I can't take any more. That's body weight. Number two, you have underworked me. That's right. This energy, because the glucose is energy, inside that cell, in these organelles inside the cell, there's something called the oven that burns all the glucose, something called mitochondria. And we don't need what you have to sell. We are full to our eyeballs in energy. You're going to go take a nap after you eat. You're going to get me so fat I can't function, and then you're going to underwork and overfeed me. And the cell says, I'm resisting the efforts to bring more of that into this cell. So what's the answer? Those are the three answers. Now let's look at the bigger picture. In your body, this adipose tissue, their chief function of the cells, these adipocytes, it stores what? Fat. That's what adipose tissue is, more or less. I mean, it cushions, it insulates, it does other things, but it's the fat storage sites in the body. And again, the bigger picture. So these adipocytes, once they fill up with fat, and especially this visceral fat around the organs, which you need, it protects, it insulates, it does things. But if you have too much of a good thing is a bad thing. So when these adipose cells, these sites that are designed to store fat, when these adipocytes are full, what happens to the fat? Answer? I'll read. Lipotoxicity, fat toxicity, is a metabolic syndrome that results from the accumulation of lipid intermediates in non-adipose tissue. In other words, the fat is where it is not supposed to be. And then it gives you the list of where it usually accumulates first. The tissues leading to cellular dysfunction and death. The tissues normally affected include, now the kidney, the liver, the heart, and the muscle cells. They're the kidneys. Those are fatty kidneys. There's the liver, that's a fatty liver. What causes fatty liver? Excess fat. You from eating too much fat. What was next on the list? Fatty heart. Yeah, there's a fatty heart. The one on the left is what your heart should look like. The one on the right, fatty heart. Yeah, I know. Now, what was the fourth on the list? The cells, fatty cells. And when the fat goes into the cell, I took this off the American Diabetes website. Muscles are responsible for removing. Why do the muscles utilize so much of the sugar? Because they do all the what? It's easy, right? The muscles, 85% of the glucose is used by the muscles. 85% of the sugar from the blood. Toxic buildup of fat in muscles disrupts this process. The buildup of fat in muscle cells sets the stage for prediabetes and type 2 diabetes. So what do? You change your diet to what? Whole food, next word, Plant-based. You get on what kind of program? Does that speed up the metabolic rate? Does that good diet kind of reduce the caloric intake? And then pretty soon your weight goes down, and so does your blood sugar. And your energy level goes up. And dear friends, if this weren't such a serious subject, heart disease, kidney failure, amputations, blindness, neuropathy, right on down the list. And it's so simple and easy to reverse. It was a Jamaican brother. I worked with a Northeastern Conference in 2014, held evangelistic meetings at Camp Victory Lake in Hyde Park in a tent. First time ever in a tent. And so the meetings were going, and the second night or third night, I did something on diabetes. What time is it? Who's got a clock? What time is it? 8:52? I was doing something on diabetes. And this brother from Jamaica stood up, and he wasn't happy. He said, "That's not an accurate picture." And I said, "Are you diabetic?" He said, "Yes." I said, "You don't have to be. You just get on the plan, and in the near future, you can reverse that." And then I said, "Why don't you get on the plan and come back every night and give a report to the people in the tent?" And he said, "I'll do it." And that man meant business. He told me the next night he bought a walking track. This guy was serious. He got a walking track, got on the plan, he changed his diet, and every night he gave his report. I think the second night he said, "My blood sugar now on my medication, my blood sugar before 160, 180, 190 is now 125. I said, "Be careful, because pretty soon your blood sugar will be low. And if you keep taking the medication, you're going to be in a bad place. So be very careful, medications, and as the blood sugar comes down, think about reducing the medications." It was about 17 days. He came in, gave the report that night. He said, "This morning I took my blood sugar fasting before breakfast, and it was 96. And I said, 'You're no longer diabetic.'" And he said, "Amen." It worked. It works. So we had 26 ladies from Barbados come to our program. 2 of them were doctors. I did a thing on diabetes, and when I finished, the lady from Barbados, who the doctor, young lady, she said, "I want to address the people here now that you're finished." Okay. She stood up, and this is what she said. She said, I want to say publicly what he said was right. But I also want to tell you there is a place for allopathic physicians. There is a place for what I do. Because if you won't follow that plan, you need my plan." And then I said, "May I say something now?" I stood up and I said, "What that woman just said, I agree with." Dear friends, hypertension, diabetes, statin drugs for your cholesterol, which are killing your liver anyway, you need to be on one plan or the other. Your blood pressure is 270 over 180, you'll stroke out and die. You need something to bring the numbers down. Would you agree? You need one or the other. Choose ye, Joshua 24:15, this day, which program you want. Now you got 2 choices. Now, this thing with exercise, this aerobic exercise, you can walk, you can talk, you're fueled by oxygen. Here's the thing about aerobic exercise. It burns fat, and it's going to help you if you're what? Diabetic. So we tell people that come, this diet, it's easy to say diet and exercise. I want to give a couple of fighter points. So we tell folks that come, you need to be on an exercise program. You need to get up, hit the trail every morning, 30, 40 minutes, every day. And after your meals, what? Because the law is, you put that first, let's take lunch. You put the bite in your mouth, in 45 minutes, blood sugar spike is at its high. And when that blood sugar level is at its peak, that muscle cell looks at you. If you are, what should you be doing? Yeah, you'd be re-educating that muscle cell. I know I'm kind of personifying the muscle cell. It really doesn't look at you, but come on. If you are walking and burning energy, that muscle cell begins to produce more mitochondria, which needs more energy because you're burning more. And you can see that's the road to reversing diabetes. So take a walk after every meal. 10, 15 minutes. Nothing strenuous, not a marathon. This is a short 10 to 15 minute walk. After which meals? All of them. You mean I got to exercise 30 minutes in the morning and then after every meal? Yes. Yeah. I'd rather have my feet cut off. Okay? And then I'm not going to read these studies, but if you can see this, the effect of 8 weeks of aerobic exercise on insulin resistance and type 2 diabetes, and this is all off PubMed. These are these studies that are being done by UCLA, USC, University of Cambridge. This is PubMed, the studies in the highest of the high medical journals. All this stuff about blood glucose and exercise, thousands and thousands and thousands of studies that say exercise helps with insulin-resistant diabetes. And one other thing, fiber. Fiber slows the emptying of the stomach. Therefore, your blood sugar goes up not quite as fast. Makes it easier on the pancreas, and it's good for a lot of different reasons. So where do you find it? Whole food, plant-based. The best in the world is found where? Beans. They even call it, Darlene addressed it last night, insulin-resistant starch. The beans. The beans have the fiber that is the best. And that's coming from all the diabetic associations. That's part of a whole food plant-based diet. The beans, the carrots, you just eat that. Now, the problem with the animal products, how much fiber? None, zero. So if you're diabetic, it's a shift from animal products to whole food plant-based, a diet high in fiber. You got your exercise after you walk, you're on a whole food plant-based diet. You just do some simple things and pretty soon you're not diabetic. Now, last but not least, and then I'm done, this is a study that's recent by the most prestigious medical journal on planet Earth, the New England Journal of Medicine. This is cutting-edge research. This is recent. A study published in the New England Journal of Medicine shows that even in people without diabetes, this is without diabetes, your blood sugar's high, but you're not diabetic, you're what? Pre-diabetes. Above normal blood sugar is associated with an increased risk of developing dementia. It established for the first time convincingly there is a link between dementia. Now, by the way, today, 25, 30 years ago, somebody 75 years old couldn't remember who their wife was. We say, well, that's dementia. It's Alzheimer's. Alzheimer's is dementia. Now, today, it's not 75 anymore. It's what? Yeah, I was going to 65, no, 60, no, 45, 40 years old. They don't call it dementia. Now we call it, what kind of dementia? Early onset. Because folks in your 40s wake up in the morning, who are you? Well, you've been married to me for 27 years. Yeah. The link between diabetes, not diabetes, pre-diabetes, it establishes for the first time convincingly there is a link between dementia and elevated blood sugars in the non-diabetic range. Says study author Dr. David Nathan, Harvard Medical School professor and the director of the Diabetes Center and Clinical Research Center at Massachusetts General Hospital. Then this is it, I finish. Why? The speculation is that elevated blood sugar levels are causing more vascular disease, but it may be other metabolic issues, and they're not exactly sure. They see the link, it's scientific. But anything that affects the vascular system, the circulation, affects how you think. Step 3. Number 1, be careful what you put in your mind. Right? Number 2, last night, anybody remember? Be careful what you put into your mind. And last night? What was the subject last night? Okay. And when I did mine, how thinking is affected by our physical habits. And tonight, how physical habits can affect how you think. My point is not that I want to be healthy physically. I want to be healthy mentally. Yes, both. Thank you, both. And it's a package deal. You can't have one without the other. And then, so my wife, when I met her, was a Buddhist. I'm going to quote the Buddha to finish. She's not a Buddhist anymore. This is what the Buddha said. To keep the body in good health is a duty. Otherwise, we shall not be able to keep our mind strong. And that's what the Buddha said. Yeah, pretty simple. And then that's something else. Pretty simple. The science of diabetes. Isn't that simple? And you take the book Ministry of Healing, that is a tailor-made prescription for reversing diabetes. All these thousands of things on YouTube, it's very simple. This is the problem. Now, cause, effect, answer. The effect, diabetes, what's the cause? And the answer? Change your lifestyle. That's it. Any questions? Darlene, you want to come up? We got about 5 minutes for questions. My wife zip up here. Not 30 years, but 38 years of marriage. Come. Okay.
For the baby, you said that something about the baby being born overweight. What is the average size should a baby weigh at birth?
I don't know. That's easy. I don't know. Yeah, I don't know. But we know that danger of overweight. We know overweight's not good. What's perfect weight? I don't know. But underweight and overweight, that's not what we want. Yes, my brother.
What was the question?
Cleansing the liver. Okay. Let me, you just went into a very controversial minefield. So let me approach it carefully and give you your answer. There's a man named Erwin Davis. He's a doctor back in 15 years ago. He's worked a lot in New York. Dr. Davis, anybody know Dr. Davis? Nice man. Dr. Davis, nice man. I just had lunch with him 4 weeks ago. Dr. Davis is a physician. He ran the little 2-year training program at Wildwood. He's not there anymore. I called him. He was my counselor. I said, Dr. Davis, we get questions all the time about colon cleansing, liver cleansing, stomach cleansing, purges, and all these things. And I said, help me. And I'll tell you what Dr. Davis told me. And I agree with Dr. Davis. He said, Lou, we got a cleansing plan. I said, what is it? He said, eat 8-10 glasses of water, exercise, good whole food plant-based diet. He said, that's the cleansing plan. Now, if you want to cleanse your liver, stop poisoning it. All right? That's what you need to do. Be careful how you treat it. You want to cleanse your bladder? Drink more water. You want to cleanse your brain?
I just wanted to mention that up to the stage of cirrhosis, if you get cirrhosis, that's irreversible. But the liver is an amazing organ. If you get on this good plan, it will get rid of the fatty liver. It will recover. Just cleanse by getting on a good plan. That's your cleanse. Mm-hmm. You don't need enzymes in your food. Your body makes all the enzymes you need. So you don't have to eat an all raw diet and get all these enzymes. God put right there in your body what you need to digest your food.
But what they're saying is the pancreas have to make all the enzymes, and the pancreas goes further and increase cancer.
The pancreas is going to make those enzymes whether you eat them or not. The body is designed to digest food. It all works together. God made a beautiful creation, so you don't have to worry about taking in all these enzymes. God put right there in your body what you need to digest your food.
To get an overview on that, we had a man that came to our program. He was taking something to prevent prostate cancer. he said, this is my prostate cancer prevention. I said, let me see the bottle. Looked on the back, it was chamomile and skullcap. That's worth about how much? 45 cents. He's paying $60 a bottle for that. Dear friends, there's a whole lot of money-making operations out there trying to get your money out of your pocket and into theirs. God's plan, you cannot make it. This was in Kingston, back to Jamaica. I was in Kingston, I think it was, and I said to a group of very nice people in that park, whatever park that is, a big park in Kingston, Emancipation Park, with the statues there as you go in. I was in the park and I said, this plan is free. You can't commercialize it, you can't sell it, it's for the poor man, it's simple and free. And he said, no it's not. Yes it is. And he said, if I want an avocado, what do they call it down there? A pear, right? If I want a pear, I got to pay money. And I said, well, dear brother, you don't pay me. You go down and pay the man in the market. I'm not making any money off the plan. And if I came in here selling you enzymes, selling you alkaline water, selling you this, selling you a machine for colon cleansing, selling you a machine, yeah, that'll be out a red flag ought to go up in your brain. This man's trying to make a buck. Jesus never sold anything. And his plan, read the Ministry of Healing. If you haven't read that book, read that book. Read the book that came from heaven, and you get heaven's plan. What came from heaven leads where? Back to heaven. Any more questions? It's getting late. One more question. That's simple, right? It's a simple plan. It's a common sense plan.
I just wanted to mention regarding the hydrotherapy, I meant to when I was up here, that if you would like the papers that go along with what I presented so that you have a list of what to do, equipment, everything, all the effects, results, if you will send me an email, I will email them to you. And my email address is very simple. It's just my name, darlenekeith@gmail.com. If you don't think you can remember that, ask me afterwards and I'll give you a card. Okay?
And we got 1,000 health presentations and materials. If you want it, it's all free.
But you have to ask for it.
But you have to ask, give me a drive to put it in. I'll give you everything we have for the last 20 years. Matthew 10, verse 8. Why don't we stand and I'll pray as we get that last verse. Freely you have received what? Freely give. Share it. The health message is to be shared, not sold. I'll pray. Father in heaven, we're thankful Jesus came down and he didn't have much of a salary. And it cost him something to do his work. We're glad the health message originated in the most holy place. We are not allopaths, we're not osteopaths, we're not naturopaths, we're not homeopaths. We're cause and effect doctors. And Jesus taught us to do that. So help us to go out and try to heal the sick and point to the Savior as the source of all healing. Bless us as we head to our beds. Bring us back to tomorrow night. Help us to be simple, sincere Christians. I ask this from my heart in Jesus' name. Amen.
And this gospel of the kingdom shall be preached in all the world for a witness unto all nations, and then shall the end come.